Hello and good morning from Cali in Colombia, where we're here for day 4 of the UN Biodiversity COP16. That's the 16th conference of the parties of the UN Convention on Biological Diversity. And great that you can join us on these, the fourth of these live updates that we're giving from the Wildlife Trust about what's happening in COP16, I should say, and crucially, what it means for the UK. We're going to have a real focus on health and nature today, and we're excited that we're going to be joined by Dom Higgins, who heads up our health work at the Wildlife Trust, to talk us through on that as well. But first of all, let me just give you a little summary of what's been happening in the sort of formal negotiations yesterday at COP16. Really 3 things coming through really strongly now. First of all, the discussion on a big topic, which is so-called the fair and equitable benefit sharing from digital sequence information. Now, this is a little complicated. We're not going to get into detail now, but we will come back to it in future broadcasts and do a bit of a deep dive into it because it's a hugely important issue. But essentially, it's trying to work out how local communities around the world, particularly indigenous communities, can get financial benefit when big companies actually get commercial benefit from the genetic resources that are there in plants and animals in nature around that nature, which is looked after by indigenous communities. Hugely complicated topic, but a very, very important one. And we're going to come back to that in a future broadcast. And there was a lot of discussions on that yesterday. Also, really important discussions about how to integrate indigenous community decision-making into the Convention on Biological Diversity processes. For example, things like management of protected areas and national parks around the world and so on. Hugely important that that's done with the involvement and for the benefit of indigenous communities. And the other thing that was happening yesterday, there was one of these so-called contact groups, which is when government officials and NGOs get together to have a detailed discussion in a sort of informal context before it goes into the formal context, about something that we at the Wildlife Trust are really excited about, the so-called Biodiversity and Health Action Plan, which is all about this plan about how we can try and make sure that issues around health benefits of biodiversity and what actions members, in other words, governments, need to take around the world to plug in those health benefits from all of the 23 targets across the global biodiversity framework, how nations can be advised and supported to make sure that those health benefits come through. A really important topic, so we're going to get into that a little bit more today. And it sounds like some really good progress is being made on that, and with the hope that that action plan is adopted at the end of this COP. So that's just the headlines as to what's been going on in the more formal negotiations here in Cali over the last 24 hours. But also Rob, my colleague Rob, you were in the Blue Zone all day yesterday, weren't you? You were there much longer than me. I had to do other things in the morning, and then I got to the Blue Zone in the afternoon. But you were there all day, and you had a packed day, didn't you?
Yeah, really busy day. It was great. It was a really good day. I met loads and loads of different people, but went to some really interesting sessions. So just pick up on 2 that I went to. So the first one was one of the first of the business community. So there's a lot of people from the corporate sector talking about how the corporate sector can improve nature and climate as well. And there's a lot of discussion around voluntary biodiversity credits. This is where credits are created by the restoration of nature, and corporates buy those credits, but that could be very easy to greenwash. So it's really careful, really needs to be done well. So I went to an incredibly packed meeting, the hottest meeting ever, and listened to a UK-French initiative, actually. So which is trying to set out international standards for UK biodiversity credit systems. So that was a really interesting one. The next one I went to, we both went actually, was around at the IUCN tent. So we're members of the IUCN, so the International Union for Nature Conservation. So that feels a bit like coming home in the international community. And they were talking about the health action plan that Craig's just mentioned there. Really interesting stuff, some powerful stuff. So, for example, this link between habitat loss, pollution, climate change, the trade in live wildlife, intensive agriculture, particularly livestock agriculture, that is actually giving rise to many, many more potential pandemics. And gave the example of a marketplace where you have 10,000 people interacting with wildlife, livestock, all stressed, all crowded, a disaster waiting to happen, Wuhan market, 2019 or 2020. So, we've been there, and it could happen again. None of that's regulated, so these things are really important. We picked up as a wildlife trust the benefits of green space and the important health outcomes, and then it's very clear that no green space is bad medicine. We need green spaces to be healthy. They talked about prevention is cheaper than cure, and boy, didn't we see that in the COVID outbreak. And that protected area management, or nature reserve management, as we would put it, is really part of the health system. It's really clear that they have enormous health benefits. So, great line, protected area managers, nature reserve managers are health workers. Call me Dr. Robert. I mean, these are proper health worker things. So this is really great stuff, So, and then another line that I really like from that meeting: health is not a cost; it's a human right. Too right it is, and an asset to the economy. So, these are really important things. Anyway, this is all the work that's been done on an international level. Of course,
can I just debate? There's a point that's so important that you were making there, Rob, that it's worth picking up on. This thing, because yesterday's broadcast, we talked about all the arguments that are happening here in Calais around the finance for the global biodiversity framework. And it sounds huge numbers, doesn't it, when we're talking about hundreds of billions, I should say, that governments need to find to finance global biodiversity framework. But given that the COVID pandemic was caused really by human destruction of biodiversity and trade in animal parts and so on, that's ultimately what caused the COVID pandemic, which cost us trillions, cost the global economy trillions. It's so much cheaper actually for governments to fund the global biodiversity framework, fund the restoration of nature, than us having to deal with the financial costs, let alone the human costs of pandemics.
And it's worth pointing out that the health budgets that each country spends, whether it's a private healthcare system or a national system like ours, are huge in comparison to nature conservation. So, if we can link clear health outcomes to biodiversity conservation, you've got a very clear route to funding there. Dom, we've been doing loads of work. I'm going to bring Dom in now. Dom, just quickly introduce yourself.
Dom Higgins, I'm Head of Health and Education for the Wildlife Trusts. And
Brilliant.
Really great to hear that you, the Health Action Plan might be nudging this in progress. That sounds brilliant.
So, Dom, we've been doing loads of work in the Wildlife Trust around health and nature, haven't we? So do you want to just give us a quick overview? We haven't got long.
Yes, of course. No, you're absolutely right. And how, it's our life support. So a lot of our ecosystems kind of restoration, you talk about clean air and water. We're helping neighborhoods to thrive, and help people to thrive, not just survive, by, bringing nature back to people's doorsteps. And then we're also running targeted health and wellbeing programs that, are proven to improve mental health, that get people physically active, that get people socially connected, and of course have a much wider benefit for the public in terms of any increased access. And it was really interesting hearing you, just and Craig there, talking about the budgets. Literally on Monday here, our own Secretary of State for Health and Social Care, Wes Streeting, has spoken about 3 shifts needed in our own NHS. Now, he talked about analog to digital, okay, but actually he's talking about from illness to prevention and from hospital to community, which is music to our ears, because we are a public health service as a family of wildlife trusts. And we have some really important evidence that shows that you can help people to stay well, prevent unnecessary illness through what we call a natural health service, and save, 634 million directly to the NHS. So that's independent economic analysis that we've had at the wildlife trusts. So it's bang on message. And just you were talking about COVID and the impact there. The number of people that dropped was 1.1 million people from 2020, when we all found nature, we all went back to our natural world on our doorsteps when it was locked down in COVID. 2022, 1.1 million fewer people went out. We've got to rediscover that, but there's a really big prize here in terms of health prevention.
Dom, just about the green prescribing, I think you were chatting to Amir Khan earlier, is it worth?
Yeah. No, he will. We've got a great video, Rob, that will just actually, for people that is new, we talk about green prescribing, but I think we can talk about nature prescribing. Let's not forget the blue, as you were talking about yesterday. But yeah, here's a video really from Dr. Amir. Now he's a GP and will tell you what it means to the health system, and he explains really clearly, better than I can, what it's all about.
Great, that's what.
Amir, we're hearing the term social prescribing more and more. What exactly is it?
It's a great term, and what it refers to is getting people into community support within their local areas to benefit their physical and mental health. So that could be things like exercise programs, knitting groups, reading groups, even things like financial support as well that some people may well need, and advice around debt management. But here in particular, we're in an area which is used for green prescribing, which gets people into nature-based activities, which we know benefits their mental and physical health.
It sounds fantastic, Amir. How are we going to get this everywhere, and what can wildlife trusts do to help?
Well, I think from a health point of view, we've got to make it easy to refer patients in. There can't be any barriers, there can't be kind of any intermediate people that they have to go and see before they get to these green spaces. I want it to be so easy that a patient comes and sees me, I will manage their medical health condition as best as I can, and I will also say to them, look, here's a piece of paper, I think you will benefit from nature prescribing, ring this number up and we can get you there almost immediately. There has to be there can't be a gap, really. That's where patients fall through a net. The other thing is, we can't expect people to go to nature. We've got to bring nature to them. So wherever they may be in a city, particularly where they may struggle to access green spaces, we've got to make sure that these places are there and ready to receive them in a safe kind of way and a supportive way. And that will be training people up. And that's where the wildlife trusts come in, because we've got reserves in inner city areas, much like this one here in Derby, where communities who may not necessarily feel they belong in nature and can get the benefits of nature are welcome and supported, and the staff of the Wildlife Trust are trained to welcome people in who are nature naive in a way, and I think that's really key in all of this.
So that was the wonderful Dr. Amir Khan, who of course is a GP, obviously a TV doctor as well, but even more importantly, Vice President of the Wildlife Trust. Isn't it great to hear from Amir? And I want to say a big shout out, hello to people that are joining us. I see that's Lynn, Brian, Lauren, Sue, Carmen watching from lots of different locations across the UK and beyond. So thanks so much for joining us today. You can join us every day at this time on Instagram, on YouTube or LinkedIn to watch these live updates. And of course, if you miss them live, you can watch them on catch up as well. I should also say, make sure that of course we put links in the chat to the report that Dom held up there during this. And really, Dom, it comes down to this, isn't it? The big issues we're facing in this agenda. There's to date, we've had really poor planning and public investment into green space. You know, and it's just not being seen as integrated in the way it could be, and there's just not been the money there that's invested in it, which is crazy, because actually if it's about health outcomes as well as nature outcomes, you know, we should be doing it. There's also been, of course, loss of urban green space and poor management of the urban green space that we have, things like mowing it too much rather than allowing the grass to grow long, and litter and all of these kind of things. And crucially, lack of investment into the providers that can provide this social and health prescribing solutions, such as the volunteering, the walking groups, the accessible green space, the kind of things you were talking about that we do at the Wildlife Trust. All of this is peanuts in terms of the money it costs compared to the cost of other, you know, trying to deal with health issues as a treatment. If we can do, if we can prevent ill health and instead promote good health up front, that's so much cheaper and better for people and better for nature in the longer term.
Very true. The government's own evaluation of their green prescribing for mental health programme has shown a sort of £2.42 return for every pound invested from Treasury. That's with them right now. But also, you know, it compares well with mainstream health interventions, you know, so, you know, half the cost, as you say, but you know, almost quadruple the benefits. We can talk about the cost savings, but all of those other benefits about, you know, bringing nature back and restoring those ecosystems, as well as, you know, the proven mental and physical health benefits. And I think Amir said something really important there about the role of wildlife trusts and other organisations to be there to support people. Sometimes having the space itself it's not enough. What we actually need is to hold people's hand there and work with them. And what you were saying there about our neighbourhoods, you know, as building the right houses in the right way. And, this is all part of the upstream approach to health. But actually, there's a good 2/3 of the population that might not feel that this is relevant to their lives. And we've got a massive role to play at Wildlife Trusts in reconnecting people and meeting them where they are in terms of their own gateways into nature. And I think that would make a huge difference, not only to their health and their well-being, but also to our cause as well, and bring more people to that fight.
Absolutely right. Absolutely right. Well, I saw a question in the chat also from Laura Moore asking about whether the value of blue spaces has been mentioned at all alongside green spaces. Lauren, you'll be pleased to know it has a bit. There has been discussions in some of the side events and so on. I think there is recognition that where we can create blue spaces, in other words, areas of public access to water and so on, particularly in and around our towns and cities, that's good if done the right way, of course, and they're looked after and they're clean and they don't have pollution in them. That can be very good for promoting people's health and well-being as well. And it should say, of course, with all of this, whether we're talking blue spaces or green spaces, particularly around our towns and cities, this is really important for climate adaptation as well, both in terms of dealing with extreme weather events, particularly hot periods, for example, the roles that trees can play in shading and cooling our cities, the role that blue spaces can play in cooling our cities as well, which is hugely important as our cities get hotter and hotter in the decades ahead. So very important. So really, we're sort of running out of time for this update today. I just want to say that hopefully, fingers crossed, at the end of this COP, governments will adopt this action plan around health and nature, which will be really exciting if that happens. And I think then it's incumbent on us, our UK government, to think about how they include and make sure they're referencing health outcomes across its own submission of its national biodiversity strategy action plan that it has to submit to the Convention on Biological Diversity, and obviously in our domestic environment improvement plan as well. We would like to see the government talking about absolutely how it can deliver health outcomes alongside delivering all of these targets in a UK context. And the fact that our Secretary of State for Environment, Steve Reed, we know is quite good friends with Wes Streeting, our Secretary of State for Health. We would really ask them to work together to deliver some combined outcomes here, which would be a really important thing to do. And this means, the kind of things this means is at a time when in England we're talking about changes to the planning system, how can we absolutely make sure that green infrastructure standards are mandatory for new developments, not just an optional extra, but mandatory? How can we make access to naturalistic green space and blue space a right, not just something that is there for the wealthier communities? I always think it's interesting that, we know people, this matters a lot to people because richer people live in tree-lined avenues. Why is it that, poorer people in our society actually don't have access to nature in the way they should? And, perhaps we should be setting up a fund to grow community-based health services and wellbeing programs across the UK as well. And ultimately, we've just got to restore land, a lot more land, make a lot more space for nature, particularly when we have so much agriculturally marginal land in our country as well. Actually, how can we use that to make more space for nature so that it restores nature and restores our country's health all at the same time? We hope you enjoy these updates. We're getting brilliant feedback from you all suggesting you ask. That's wonderful. Don't forget to sign up to our daily notifications. You can do that on our website. Colleagues will put a little link in, I'm sure, as well. And there you are, there's the QR code. And we'll see you tomorrow. Actually, I think probably Rob will see you tomorrow. I have a clash tomorrow that I'm going to go meet the UK government delegation tomorrow at exactly the same time as this broadcast. So you might not see me, but do join in for these updates that happen every day. And it's going to be goodbye from Callie. But Dom, thanks so much for joining us today and talking about how we link the international, the global discussions on nature right down to the local in the UK, and particularly what the Wildlife Trusts are doing around the health and nature agenda. From us in Callie, thanks very much. Good night.